Hey friends, welcome to this installation of our Shop Talk series on sports medicine. Today I'm delighted to have a fellow St. Louisan with me, Dr. Tang. He is a Western MD. He's got a background in biochemical engineering and physical medicine rehabilitation. He has worked, I should say he did work with the St. Louis Rams when they were in town. That was a little while ago, and he's been the team physician for Lindenwood and Washington universities. Dr. Tang has studied at the Helms Institute, very prestigious institute for MDs, and spent some time in China. So he's got a background both in Western and Chinese medicine, and his thing is sports rehabilitation. So what a great way to blend two worlds together. I'm delighted to have you here today, Dr. Tang. I'm curious to begin with, tell us a little bit about what it's like to practice acupuncture as an MD in the sports medicine world.
Yeah. So acupuncture has been a very useful tool for me. When I was working with the St. Louis Rams, as you alluded to, I was actually mainly doing acupuncture on the patients, on the players rather. So at that time, that was sort of at the beginnings of when dry needling was becoming more popular. Obviously we know that this has been a very useful tool for various musculoskeletal complaints for much longer. So, yeah, I think oftentimes people are a little bit surprised when they say, especially at WashU, like a big academic institution, that they have acupuncture services. And so when I first started, it was a little bit, kind of getting them introduced to it. I work in the orthopedic surgery department, so also, they maybe are not the most accepting of alternative treatments initially, but I think that, I've been here for a long time now. One of my mentors, Dr. Heidi Prather, when she was here, she was also sort of, worked really well with the surgeon. So over time, you kind of gain their trust, and they, if you kind of know what they know, but then in addition, you can offer this other treatment, then they're more likely to trust your recommendations and trust the treatment as well. So I've been very fortunate to be able to practice acupuncture in this large academic setting. It's had its challenges, a lot of it mainly surrounding, billing, but it's been great. It's been a great tool.
Yeah. What got you interested in acupuncture in the first place?
So for me, I'm Chinese heritage. I was born in Taiwan, and I speak Mandarin Chinese. So it was always a way I was interested in it because it connected me with my, my heritage. But also within medicine, I've always been interested in things that we don't fully understand. So even in medical school, if things were very algorithmic, and, something like that, it was not very interesting to me, but I always like things that we don't truly understand, or we have, there's a mysticism surrounding it. So that's why I learned it in the first place. And then it worked out perfectly in terms of, when I chose my specialty with physical medicine and rehab, we deal a lot with musculoskeletal complaints, and acupuncture, that sort of pain and musculoskeletal complaints is probably the most useful thing that acupuncture is used for.
Yeah. It's famous for treating pain.
Right.
I sometimes have people ask me, like, what else I treat besides pain in my clinic. Like, when you treat pain, is there anything else you can use it for? And I always find myself saying to them, actually, the pain patients I have are not that many, right? I do a whole lot more internal medicine. And, it's always such a surprise for people to hear that. Yeah.
Yeah, I guess our practices are probably opposite. For me, it's, 95% pain complaints, but pain and function too. Some of... Mm-hmm. When people say pain, a lot of times people might come to me with other, functional deficits, like they can't walk very well, or even some like numbness symptoms, which might be nerve-like, but those can all, I guess I've wrapped those up all into kind of quote unquote pain. But I do treat mainly those musculoskeletal complaints and less of the internal medicine stuff like you do.
Yeah. Well, you send me the internal medicine, I'll send you the pain patients, and we'll be happy. How do you see the Western medicine side coming in and helping to inform your Chinese medicine side?
So I'll be honest, my Chinese medicine knowledge is very poor. So I'm a Western medicine practitioner, basically. I've learned a lot of some of the principles of Chinese medicine, but in terms of a lot of the theories of the yin yang qi shui and how all that works, I I don't really use that to inform my needling, honestly.
Mm-hmm.
And, I'm not very well versed in it. So for the most part, when a patient comes in, I kind of use the Western medicine approach, musculoskeletal sports medicine approach to try to figure out what's going on with them. And then for me, the needle is a tool. So the needle is used to kind of release myofascial tension, or it's used to, stimulate nerves, potentially, something like that. But primarily I evaluate people using really more of a Western medicine-based theory.
Fair enough. I mean, one of the things I find really interesting about practicing acupuncture is there's a bunch of different ways to think about it. There's a lot of different ways to evaluate, from just hands-on palpation and not really thinking of the, chi or blood or anything like that. I mean, a lot of the Japanese traditions, they just put their hands on people, they feel, they treat. That's that. There's not a whole lot of theory. It sounds like you're thinking very much about nerves. You're thinking about tissue, the quality of the tissue. How do you do your assessment in terms of what is going on for the body and where you think it needs some attention?
Yeah, so I think for me, the first thing is I use the Western medicine approach to rule out dangerous conditions or things that need maybe urgent surgical referral. For example, if someone has like cervical myelopathy where their spinal cord is getting pinched, they might have some upper motor neuron signs. They might have unstable gait. And then if we're suspicious of that, then I need to order the imaging, and they probably need decompression of their neck, right? So, and then, kind of a strength testing. So I do all of that. And then there's, different physical exam findings can point to different structures as maybe causing pain. Like maybe if for shoulder pain, it might be there's certain tests for rotator cuff, for example. You check that, you check like passive range of motion of your shoulder, active range of motion, and that can give you a sense of, is it arthritis? Is it rotator cuff? Is it something else? And then obviously we have the luxury of imaging, so we can get x-rays and then possibly MRIs later. And that can also help inform us of the diagnosis. But then in addition, I think what I do differently than, I honestly don't know really any other Western medicine providers, or I'm sure there's some, but there's not many that do more of like a palpation, like I palpate for muscle tension as a big part of my physical exam, which I think is different. I also assess posture, because a lot of times patients present with a certain posture because certain muscles are shortened, and then maybe certain muscles are overstretched. So the posture gives me a sense of where to start with the palpation. But palpating for, muscle tension is huge for me. And that's a little bit different, I would say, than most Western medicine practitioners. And usually, I hear this not infrequently, but when you actually touch patients, you're like, oh, wow, like I didn't know that no other doctor has palpated or touched me before. And you're like, oh, okay. But it's really, after you do it this way, it's hard. You can't go back. This helps you so much in terms of figuring out what's going on with the patient.
I think this is such a big thing, and I hear this a lot as well, because I put my hands on people in an attempt to understand what's going on. People can tell me one thing, but my hands say something else. I'll often hear that as well, that, oh, well, you're actually feeling for what's going on. And by the way, I didn't know that it was sore here where your hand is right now. How did you know it was? And I usually tell them, well, I didn't know it was. I put my hands here to find out if it was or not. I think it really helps establish some trust with people in ways when you put your hands on them, and just something about the physicality of doing that is really helpful.
Yeah. And I think, usually, even actually, I'll say in the acupuncture training that I initially received at the Helms Medical Institute, which was mainly, basically the main training that MDs or DOs in the U.S., if they do acupuncture, they usually go through that course. They actually don't do that much palpation either. I actually learned a lot of this later. But, when you feel for muscle tension, you almost always, when there's increased tension there, that's going to be where patients feel pain. And so patients often say, oh, like, how did you find, you can find my pain, you can feel my pain. But like you said, I think that's very validating and creates trust for the patients.
It sounds like you also spend time really paying attention to the structure. You're looking at people's posture, you're assessing their gait. What else are these things telling you that the average acupuncturist might miss if they were to start looking at gait and start looking at posture? What might they be able to find that they're missing right now?
Yep. So I guess I'll give an example. So upper trapezius pain, if it's kind of up in the neck area, a lot of people have a lot of pain up in their neck, right? And it's usually muscular. So myofascial pain, upper trapezius. And when I look at someone's posture, the shoulder that's painful, maybe the left side of their neck is painful. That shoulder could be sort of elevated relative to the other side, or it could be depressed, right? So it could be either one, actually, or it could be even. But usually if there's pain there, it's probably more likely elevated or depressed. I've found that a lot of times, like if it's elevated, that muscle is probably shortened. And so if you just directly treat that muscle, then they should probably do okay. But a lot of people, that muscle is actually overstretched, so it's depressed. And so if you treat it, they might feel better temporarily, but then it keeps coming back. So then you have to kind of look to find like what other muscles are kind of pulling that arm down, pulling the shoulder down. And then you got to treat and release those. And then oftentimes that will be the trick to kind of releasing their whole muscle tension and restoring their balance. So that's just an example of, kind of how that might inform someone, or how that informs me of like, I need to look elsewhere, kind of how their posture can affect their pain.
Yeah. It's interesting. People often come in, they'll point to one place where it's painful, or they've got some impingement in motion or something like that. I'll go and I'll palpate, and it might be kind of tight, but it's way tighter on the other side, like significantly tighter. And I probably see that 70% of the time. Where the problem is, I guess you could almost say that there's a deficiency going on in that space, and the excess is actually in a different area.
Yeah, I agree with that. I think that for me personally, when I needle, I always go where the greatest tension is, or where the excess is, I guess is what you're saying. Because, I think a lot of the meridians that are in acupuncture are myofascial chains and myofascial connections, right? So you can have tension along the chain, but and where you manifest your pain may not be where the greatest tension is, and it may not be where it needs to be released.
Yeah, I would agree with that totally. And that whole fascial chain thing is so fascinating. When Meyer's book on anatomy chains, was that the name of it? Trains, yeah.
Yeah.
When that first came out, it just kind of blew my mind, looking at what they were finding there. It sounds like this really helps to inform the work that you do.
It does, yeah. Actually, so my mentor in China I met a very famous acupuncturist at the 301 People's Liberation Army General Hospital in Beijing, China. And so she was the one that translated the Myers book from English to Chinese.
Okay.
And so she actually got a lot of notoriety from doing that. And then, she said that, when a lot of acupuncturists in China, and probably here too, once they read the book, it really opened their eyes as to like, oh, this is probably what we're doing. We're treating these myofascial trains and chains. So, but yes, anyways, I do actually use that probably more than sometimes the traditional meridians, kind of follow a lot of the myofascial chains.
Yeah. What about nerves? Before we were rolling some tape here, you were telling me that there's some work that you've done actually with Pony Zhang, with studying neurology and needling into areas where there are nerves. How do you think about using the nervous system in the treatment that you do for sports medicine?
Yeah, I think the treatment of nerves, is a little bit more nebulous, in terms of what exactly it's doing, because I think that the central nervous system and the peripheral nervous system is just so complicated. Even, you have different, sensory nerves in your skin, and you have nerves everywhere, right? There's not a part of you that doesn't have feeling. And so when you stimulate those things, like what happens? It's a very complex, series of events. I mean, there's local things that happen, but then there's, you get stimulation in the brain. There's functional MRI studies that show activation of different parts of the brain with acupuncture. So I think it depends on what maybe effect you're trying to achieve. I think there's some acupuncture points, that are obviously you're aiming for the nerve, right? Like pericardium 6, it's right over the median nerve. I actually think that so nerves actually are 50% fascia. There's 50% neurons, but approximately 50% fascia, like the lining of the nerves. And I think that's actually a lot of how the acupuncture primarily works. It's if you kind of stimulate the fascia it can kind of release, and you're getting some like systemic effect from that, But then in other times, if you're just kind of needling very superficially, you're stimulating different nerves, maybe than you would if you're aiming for a larger nerve, right? So I guess that's how I think of it. Mainly with the larger nerves, I think it depends on what effect you're trying to achieve, and if so, then you kind of aim it at, you know where the nerve is anatomically, and you want to try to get the needle tip close to it.
I hadn't thought about how the nerves are wrapped in fascial material. I hear you say it, and I think, oh yeah, that's right. And so anything that you do with the fascia, because it's contiguous with what's wrapping the nerves, it's like it can't not affect it.
Right. Yeah, and there's a lot of good work by So I probably, a lot of the acupuncture that I do is informed by what Myers does, and then also Stecco. I don't know if you've heard of that name. There's the Stecco family. So it's Stecco. For any other acupuncturists, that listen to this, I would highly recommend also looking into their books. They published extensively on this, and actually hit the father's name is Luigi, and then there's two children, Antonio and Carla. Antonio is a physiatrist like myself. Carla is an orthopedic surgeon. But they take a very heavy bent on everything being fascial related. And so they've done a lot of fascial dissections. But one of the things that was very cool was nerves, they talk about how the nerves are enveloped in fascia, but they sort of telescope, have like a lining, it's a tube. And so like when you extend your hand or you move it kind of telescopes out. And that's what allows, nerves are not very pliable, but with the fascia, then it allows the nerves to kind of stretch and it doesn't injure the nerve, right? But the nerves also have to go through different fascia layers as they cross different planes. So if you have like a fascial restriction somewhere along this path, then you start getting like nerve symptoms potentially, right? So if you can kind of they don't do needling, but they use like a manual technique. It's like, they call it fascial manipulation. You use your knuckle or an elbow to it's kind of a very vigorous massage to work out the fascia, then that improves the patient's symptoms.
So would it be fair to say it all comes down to the fascia?
That's their theory, right? I think for sure, I think honestly, I think fascia is super important. I think, we have blood vessels, nerves, and fascia are sort of like the systems that are ubiquitous in our body. But I think the fascia has been the organ, we'll call it an organ, that has really been ignored in Western medicine practice for sure. But I think that we are finding that it's more and more important. And I do think that needling acupuncture, a lot of it really does work through this fascial system, myofascial system, neuromyofascial system.
Okay. So here's a $64,000 question. We often talk here in the trade about we needle to bring the chi or to, release something. We're trying to, quote, free something up. These are all free the chi, right? We like to say free the chi. We're opening up the chi, which is a lovely thing to say. But I often, in the back of my mind, I'm thinking, what are we actually doing? I mean, physiologically, what is actually going on? It's a nice idea to say we're opening up the channels and collaterals. But I have often in the back of my mind had this thought about what is going on in the tissue. And especially as we look more and more at the fascia and, some of the work that like Neil Thies has done with the interstitium and looking at the fluid pathways and just all the incredible ways that the body is held together by these sheets of fascia. I find it really fascinating. From your point of view as a Western doc, What is going on when you put a needle into that fascial material? Why is the fascia responding the way that it does to something as, apparently, as small a stimulation as a little filiform needle? What is actually going on here?
Yeah, I mean, that is a very good question. I think we have, there's some studies that can inform us of some of the things that happen, but actually what happens, is honestly, I think it needs more study, but some of the things are that, okay, so I don't know if there's Helene Langevin is someone that name comes to mind. She's a researcher. She's done a lot of stuff on fascia. So, fascia has a lot of like fibroblasts, and these fibroblasts they respond to stretch. There's a lot of things that are mechanical. Your body senses mechanical stretch or some sort of stimulus, and it responds appropriately. So I think that needle is that stimulus, right? So like you needle the fascia, it feels it, you twist it. The fascia there, the fasciocytes and the fibroblasts feel it, and then they kind of change, and then you get a response. Also, the thing is, fascia and muscle are very interconnected. Like, if you have a piece of steak, right, you can see like it's basically the fascia layers, the marbling, or not marbling, that's more like fat, but like the fascia interpenetrates into the muscle tissue. And so the muscle and the fascia really cannot be separated. And so, when you can even say that the fascia is probably helping maintain the basal tone of the muscle. So when you stimulate the fascia, it changes, it kind of releases that whole structure. The muscle loosens up, the fascia releases. And I think that's, what we're feeling, or when you release the qi, I guess, in more of the Chinese medicine terminology.
I mean, that's the way we talk about it. And I can think about it that way. I'm trained that way, but I'm also a Westerner. And there's a part of me that's always thinking, well, what the hell does that really mean? And what's going on at that more physiological level? I like to be able to explain it to some degree. And I mean, I find it fascinating. You were talking about the fibroblasts and all these things that give tone to the muscle, and somehow just changing them. Before we sat down to have this conversation, we both had some trouble with our microphones, and we just unplugged and replugged, and everything started working again. And sometimes I think about putting in an acupuncture needle, and it's a little bit mysterious that way, that it changes something, and the whole system just kind of reacts and changes. You said earlier that you like to study things you don't fully understand. I do too. This will keep us busy for a lifetime.
For sure. I mean, this is super fascinating to me. I mean, actually, I was very fortunate I was a few minutes late to our session because I also do some research, but I was contacted by the biomedical engineering department here. So we are actually studying myofascial pain. So they have a device where they're using like surface EMG, and then there's like a probe with a fiber optics probe. So we're trying to basically study trigger points and trigger point injections versus dry needling, and kind of how that changes objectively some of these things. But yeah, like I said, I think that this is super interesting because I think that the effect, the myofascial system has such a profound effect, and no one knows about it, which is crazy to me, there's so many patients running around that have chronic pain that they see all the doctors and all the imaging is relatively normal. They don't know what else to do with them. And, we see all these people, right? But I think that a large reason for that is just we as Western medicine practitioners just don't understand the myofascial system.
Well, I would say us as acupuncturists, we have a rudimentary understanding, but I think there's just so much more to learn. There's just always so much more to learn. And, I've got friends that do Japanese acupuncture. We're talking about nerves at the very surface. And their thought is you stimulate those nerves at the very surface of the body, it actually goes very deep into the brain because of the embryological connections between the skin and the brain. And it's an interesting theory. I'm very excited to hear about the work that you're doing with your research, because it might shed some light on some of these older traditional things and at the same time show us in the modern day how we can all be more effective in the work that we do.
Yeah, and I think, for me, being Western medicine trained, a lot of the Chinese medicine theories and metaphors, I sort of understand them, but they're not very, they're too nebulous to me. So, for example, like when I was in the Helms course or in other acupuncture courses, when they teach you when you needle, like what are you feeling for? Like what, I'm sure you've heard of the fishing analogy, right? It's like,
yes. We all learned the fishing analogy.
Yeah. And I'm like, what is that? Right. But when I learned that, my interpretation is that you're actually engaging the fascia. So when you put the needle in and the tip of the needle hits the fascia, you feel a change in the resistance, right? And so you're kind of putting it through the fascia and you're kind of pulling, you twist it and you pull on the fascia, right? But if you can kind of think of what structure am I trying to stimulate, trying to hit with my needle, to me that makes a huge difference in your needling efficacy and just, it gives a real, to this fishing analogy, it gives you something that you can actually, to me, much more satisfying. Like, now I understand it.
I hear you, my friend. I'm looking for the satisfying explanations as well.
Yeah.
Well, I appreciate your time today, joining us here on Shop Talk. And you mentioned what was their name again? The Stecco family?
Stecco, yes, Stecco.
Okay, I'll make sure their information's on the show notes page. And anything that you'd like to share with us in terms of studies or whatever, just send that to me and I'll put it on the show notes page and our viewers and listeners can avail themselves of it and learn something new.
Okay, sounds good.
All right. Thanks so much for your time today.
You're welcome. It's been a pleasure.
When practitioners reach for a Chai Hu Guizhi Tang or Shao Qing Long Tang, they need quality that they can trust. Lhasa OMS supplies the herbs your clinic needs to be ready for the cold and flu season. Visit Lhasa OMS to source the classical formulas featured in this series. Use the code REMEDY20 for 20% off your next purchase at LhasaOMS.com. Some exclusions apply. See the website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.